So in my experience, the experiential therapies, particularly sociometry and psychodrama, have some advantages compared to traditional talk therapy, mostly related to their experiential nature and action-based nature. Psychodrama and sociometry were the first therapeutic approach to involve the body in the process. And this is especially important when we're working with trauma, or addiction for that matter. I mean, I think all addiction treatment is trauma treatment. What we've learned through neuroscience research in the past few decades is that trauma and adversity have a profound effect on the body and the nervous system. Beyond just the mind or psychology, trauma really leaves a nonverbal imprint on the body. And because of this, it's really important that we're involving the body in our interventions, in our therapeutic approach. Because trauma and adversity impact individuals at levels below thinking and cognition, it's important that we involve expressive techniques in our work. For example, in some research they found that when we take a brain scan of somebody who's remembering a traumatic memory, and we look at the speech and language center of the brain, which is called the Broca's area, it looks like it's completely offline, which really challenges us working with trauma to consider alternatives to relying on talking or words or thinking when we're processing traumatic content. Now, the experiential nature of sociometry and experiential therapy for most people feels much more engaging than sitting in a circle and talking. I know the young adult clients that I work with especially appreciate it. They pretty quickly lose attention and pretty quickly get sick of hearing somebody lecture to them or talk directly at them. And they're much more engaged when they can get up and move around and connect with their peers. I think experiential therapies are especially useful when working with young people because of the different developmental tasks associated with adolescence and young adulthood, specifically geared to acceptance within groups and peer identification. Now, the experiential nature of this type of work also lends itself to deeper catharsis and what we call action insights, where sometimes when we're just talking about a problem that we have, we might be less likely to develop new insights related to it than if we were to get our whole body and every part of our brain active in the process. If we're moving around, if we're expressing ourselves and talking about the problem, expressing aspects of the problem beyond just words, we might be more likely to have new insights related to that problem and a solution to it. These experiential processes, of course, are also very useful in community settings, and they're used regularly by activists working in a variety of different settings. For example, activism around poverty, around immigration, around racism, around environmental justice issues. Activists have been using these tools for years and years and years because they really engage communities and they really engage groups. Of course, you can use these tools for teaching as well, and there's a large body of literature related to experiential teaching and the effectiveness of experiential teaching compared to simply lecturing to students. These experiential processes really create an atmosphere where students can contribute to the learning and teaching of each other while interfacing directly with some of the topics that we're trying to teach, to move around and to reflect and to consider how these topics that we're learning apply directly in their lives. There's something about the experiential approach, and I think the holistic nature of it, that really involves the entire person in the process and makes things a bit more engaging for participants, not just on a cognitive level, but on an emotional level, and for some participants on a spiritual level too.
I use experiential methods in my work because it's effective, it's creative, it brings an element of joy into work that can be very taxing for the client and the clinician. I work primarily with trauma patients. My clients are often referred by other clinicians who have gone as far as they can go with traditional talk therapy. And it's a hard population, and it's hard work. So if clients have worked with other therapists, they've been sitting in a chair talking about their history, and it hasn't helped them get where they want to go, we got to try something new. And experiential methods, for me, fit with my temperament, my style as a human who walks in this world, and it works. I had a client yesterday in individual therapy who's been a part of my weekly trauma group for about 4 months. The group started a year ago, and she was noticing the difference in her functioning today in February versus a year ago, February. And she said, I am changed. I can't believe how I am. Maybe it's the meds that I've gotten right. Maybe it's that I exercise a little more. But I'm pretty sure it's this psychodrama thing that I can't describe, I can't explain, but I know it's changed my brain. And for me, that's good enough. She was highly resistant. Now she's completely integrated in this group. She participates, she loves it, and she's one of many who had experiences that helped her heal and grow. That's why I do it.
I would say I use these methods in my work is because when I was first introduced to experiential therapy, specifically psychodrama, it absolutely revolutionized the way that I look at therapy. And I was introduced to psychodrama pretty early on in my education and career, but at that time, I thought I had an idea, a pretty solid idea of what therapy looked like, and psychodrama completely rocked that. And so I think ever since then, something that Scott had actually mentioned, I remember coming up to him on my second training and saying that I have all this motivation and passion, and it's there's a bug that goes around, a psychodrama bug, and I definitely caught it. For me specifically, I would have to say, I'm pretty early on in my training, so I mostly use sociometry, but I have also utilized psychodramatic letter writing, so I would say that is my favorite one to utilize. I say that because it also gives the clients almost full autonomy. It's a lot of exercise that they'll go back and do, and I've seen great things and breakthroughs occur just in that, and it gives way to that autonomous healing center that's talked about in psychodrama, that this person kind of went and did the work on their own, and I had a very little part in it, and that seems to be a theme in this kind of therapy, is that it happens, and it happens within a client, it happens within me as well.
If you're interested in learning more about specific experiential therapy processes, I encourage you to check out the video series that we created. You can find links to these videos in the description below. These videos both depict different experiential therapy techniques in action and include some teaching pieces that can help you safely and competently use them in the groups that you facilitate, regardless of if those groups are therapy groups, community groups, educational groups, or organizational groups. In the videos, we depict the use of spectrograms, the use of step-in sociometry, the use of the locogram or the floor check, and circle strengths, which is another experiential tool. These 4 experiential processes are primarily sociometric in nature, and of course they're experiential processes. They're tools that, after observing them and seeing them in action, you can take these and use these in your groups with positive criteria pretty safely. I would encourage you to pursue additional training in these methods before really using them with negative prompts or traumatic or trauma-based prompts, just to ensure that you're not practicing outside of your level of competence or outside of your area of training. Of course, these are just 4 simple experiential therapy tools, and there's many other experiential processes. If you're interested in learning more, I encourage you to use the website www.psychodramacertification.org, and using the search engine on the website, you can find a psychodrama trainer in your geographical location, or a psychodrama trainer that offers trainings online. If you wanted to see what trainings I have in the future, you could access a list of trainings on my website, which is www.phoenixtraumacenter.com/training. I look forward to hopefully meeting you in the future and hearing about how you're using some of these experiential processes in the groups that you facilitate. Feel free to reach out to me if you have any specific questions. I'm happy to be helpful or to discuss these videos further. Thank you.